Our next speaker is Daniel Zurita. He's supervisor with the U.S. Federal Probation Department.
Good morning. Thank you, everybody, for showing up, and thank you for permitting me to sit on this panel. This is the second annual summit, but it's the first time any federal representative has been here, and I think that has to do with sitting on the Safe Communities Reentry Council. I have a selfish interest because I'm also a San Francisco resident, but I'm also a federal probation officer. In terms of numbers, the Northern District of California for the United States courts covers all the way from Monterey all the way up to the Oregon border. And you guys probably think, wow, you must have a tremendous amount of offenders under federal supervision. Well, we have a fair amount, and 14% of those actually are San Francisco residents. So we do have a good number of federal offenders which we supervise through our agency. Some of the things that are nuts and bolts in terms of how we work with offenders and reentry services is we are very proactive in working with where we get our offenders. We have offenders that do not come from county probation, jails, or state prisons. We get our offenders that we work with from the Bureau of Prisons. If any of you have been over to Dublin, you know there's a federal correctional institute in Dublin. That's the only one that is within our district, but we have individuals that are released from Oklahoma, FCI Sheridan in Oregon, Los Angeles. So we have numerous people that serve their sentences at different places and then come to where they have family and a network of support. It's our responsibility as federal probation officers to conduct visits at residences anywhere from a year to 2 years in advance of their release, to meet the family members, go to the residences, see the suitability of the support network and the layout of the residence. So we do quite a bit even before an offender is released. 78% of the individuals nationwide released from the Bureau of Prisons are then placed in our residential reentry centers known as halfway houses. An officer is obliged within 10 days of a 4-month commitment at a halfway house to meet with the case manager, the offender, and start that reentry process, all the way from establishing to make sure that the home inspection that was done up to a year in advance is still suitable. What are they doing for employment? Making sure that they're in treatment services. When an offender then fulfills their time of custody, then they actually come under federal supervision. And the average time on supervision is about 3 years. They are to report to their officer within 72 hours. And at that time, we do what are called piggyback services. If an offender while in the halfway house was receiving drug or mental health treatment services through their contracted provider, we will also use the same contracted provider so that there's not a disconnect of offenders then saying, okay, I established a rapport with my therapist in getting mental health treatment services or individualized drug counseling, and now you're telling me to go to a different treatment provider. So we're also very conscious at different federal levels in working with released offenders in terms of, is there a continuum of services so that there's not that break in treatment that has been provided. Within our agency, we're also just started, and part of my selfish interest for getting involved in the Reentry Council was we have a strong workforce initiative right now that we have put into place. We are trying to do everything we can to form partnerships with one-stops, to reach out and meet other community-based and faith-based organizations, because we realize that our population is in fact releasing to this city, and San Francisco has these different reentry services that we want to be connected with, and we want to have partnerships because we're all stakeholders in the same ultimate goal, and that is to break the cycle of recriminality and recidivism. I think that's about all I have to say for now.
Thank you, Daniel. Our next panelist is Patrick J. Boyd. He is the Chief Deputy with the San Francisco Adult Probation Department.
Thank you. Good morning and welcome to all of you. Thank you for being here. I'm relatively new in the San Francisco Adult Probation Department. I've been here about a month. I'm learning the city and the department, although I've spent my entire adult life in corrections and reentry programs. The San Francisco Adult Probation Department is responsible for the supervision of approximately 8,000 probationers. About 7,000 of those are felony probationers, and about 1,000 are misdemeanant probationers, specifically with domestic violence or DUI cases. The vast majority of these 8,000 probationers have been in custody, some for short periods of time, some for extensive periods of time. Some of them are also concurrently on state or federal parole, and many are also on probation in other counties, primarily in the Bay Area. Our business in probation is reentry. That's what it's about for us. The services we provide are supervision, monitoring, and enforcement. We collaborate with numerous public and nonprofit community organizations for a wide range of services for the probationers. The men and women receive services including substance abuse treatment, housing, employment training, employment placement services, homeless support, and violence prevention programs. In the past year, the San Francisco Adult Probation Department has been undergoing a major transformation. With the support of Mayor Newsom, the judges, and the Board of Supervisors, Jeannie Woodford was brought in as the new Chief of Adult Probation approximately a year ago, and she has implemented a transformation to refocus the resources of the department on community supervision, to implement assessment systems to determine the needs of the men and women on probation, and to establish specialized caseloads. We've established specialized caseloads including domestic violence, sex offenders, 18 to 25-year-old young adults, homeless, and mentally ill. So we're making major changes in terms of delivery of services from an office-oriented operation to a focus on getting out into the community, providing more direct supervision and support for the probationers, and ensuring a much higher level of collaboration with our community partners. Thank you.